opioid use disorder and this epidemic is really just touching people from all walks of life. I think the people who are most affected by this are really anyone, to be honest. I think, every day in clinic I see, construction workers, I see people who are homeless, I see people who stay at home with their kids, I see people who work in all walks of life. And so I think something that's really unique about this is that there's no stereotype, there's no one person who has this disease and disorder. It's really just impacting everyone. So the substance use disorder program at HealthPoint started providing what we call medication-assisted treatment for opioid use disorder. And so what that means is that we provide medications to patients who have this disorder. The way it's currently set up is that physicians or providers who've gone through an extra training are able to provide this medication to patients. I believe every one of our sites we have at least one physician who's been able to provide that medication to patients. The mission of this programming at HealthPoint is really the same mission as HealthPoint. I think it's really to, respond to the needs of our communities and respond to the needs of our patients. Our program at HealthPoint really works acknowledging that we need to meet people where they are and kind of bring them into care whenever we can. And then the people that we have working on the team are our behavioral health staff. And so every patient will see our behavioral health staff, because knowing that addiction and opioid use disorder is not something that a medication can fix by itself.
Our Suboxone program, behavioral health, we're very much part of the care team, and we practice integrated care in that, because a lot of our patients with opiate use disorders, not all, but a lot, have a history of trauma, adverse childhood experiences, so we can really help with trauma-informed care, offering behavioral interventions along with their recovery, relapse prevention, things like that. And not only focusing on their addiction, but also helping with just general lifestyle change, support, and sometimes helping them find other resources or support in the community as well.
So HealthPoint has been partnering with a lot of local organizations to really come at this epidemic from multiple different ways. And so specifically here in Auburn, we have Valley Cities, which is one of our mental health partners who we work closely with for patients to get kind of that mental health support and that behavioral support. We also work with the local emergency room and hospitals, and so when patients show up to the hospital and there's someone who has an opioid use disorder who wants to get treatment, the hospital will actually send people to us for that care. And we've also been working with the police department and fire department to kind of expand our access for the life-saving medication naloxone that can reverse an overdose if people have that. And so this really is a community-centered approach to care, and it's something that we're continuing to do, and whether it's meetings with public health or meetings with other clinics or hospitals or organizations. And so it's really coming at this epidemic from multi ways with multiple different organizations.
It's an honor to do this work, and I really just so enjoy the progress that people make. So when someone comes in initially for care and we're doing their intake, getting to know them, and they're at such a low place already, is really establishing that rapport, understanding what their goals and their needs are, what their expectations are. Again, really, for a lot of patients, surprising them that we're not judgmental, that this isn't a place about more stigma and more judgment, that they need to be fearful about talking with us about their histories and their life. And just really, over time, seeing that grow, and how, week after week, and as they progress, not only as they know that their disorder is being treated and they're improving in terms of their functioning, but their quality of life.
The biggest challenge facing our program right now is the volume of patients that we're seeing. As one of the only places taking such an open-minded and open-framed approach to substance use care like we have here at HealthPoint, we've seen a lot of patients coming in to seek this care. And so one of the things that we're realizing is that we maybe don't have enough staff to deal with this, or maybe our rooms aren't set up the right way, and having more of a kind of those touch points with what happens if they do relapse and they don't show up for a couple weeks? Who's going to call to bring them back? And so I think having this extra support, whether it's people, whether it's kind of restructuring some of our clinics and perhaps, increasing the amount of space where we can see people, or getting more support in the lab to help deal with the lab tests and the drug testing that we do. I think those are all ways that we're really looking to continue to grow. And we're almost at that capacity point right now because we're busy primary care clinics, and so we don't just see people with substance use disorder. We want to see people from all walks of life, but this is a huge need in our communities. And so how can we continue to help meet this need while also making sure that we're taking care of the whole person, whether that's the people with substance use disorder or whether that's the other patients who we see on a day-to-day basis. And so I think the biggest need and the biggest ask is really for those people in those places that can help support this program.